I am Stacy Kazenchuk, Gennev's Director of Health Coaching, and this is our weekly webinar wellness series. And I'm excited to have Dr. Erika La Vella back. Some of you may remember her from the podcast and webinar she did back on the microbiome and immune function back at the beginning of the COVID-19 pandemic, which seems long ago and not so long ago, all mixed together. But today we are very fortunate to have her back talking specifically about the microbiome and menopause. And we're going to learn about the microbiome that exists in the gut and the vagina. So two components here, and she's going to talk about the relationship. One thing I'd like to say before Erika introduces herself, this topic is a very broad topic, or a large topic, and we are going to probably just scratch the surface today and still give you a ton of information with that initial scratch of the surface of this topic. That being said, we are aware of the interest in this, and we are planning to have Dr. La Vella come back on the second Wednesdays of every month. That will be the plan moving forward to talk gut microbiome, and there's so many different directions we can go with this. So if you have specific questions or topic suggestions, we'd love to hear them. That can also be put in the chat or the Q&A, but know that we're going to do our best to cover as much as we can in the 57 minutes or so we have left, but there'll be more to come as well. So thank you, Erika, for joining us, and go ahead and give our audience a background about you, what you do day to day, and how you came to be interested in the microbiome.
Yeah, well, thank you guys so much for having me again. I told you it really lights me up to talk about these things, and I'm really passionate about sharing the microbiome science with anyone who's interested in taking care of their bodies for their own health's sake. So I am a practicing weight loss surgery surgeon. I do bariatric surgery and general surgery and robotics. And while that is my day job, my side job is to teach the world about microbiome science. I first got interested in the gut microbiome when I was in medical school, and I was having lots of gastrointestinal issues, lots of hidden anxiety and depression that was just manifesting its way into my everyday life. And I always felt like I had a really, kind of privileged upbringing and didn't understand where these feelings and emotions were coming from. And really the gut microbiome pieced it all together for me. So with that, I would like to start explaining what the gut microbiome is, if your listeners are ready, because let's do it.
Yeah.
So the microbiome itself, the word, means that it's not just bacteria or viruses or parasites and different, microscopic creatures, but it's actually their genetics. So what they're doing biochemically from a biochemistry perspective, and then how does that chemical information then interact with our physical body? And it's pretty miraculous to me that all of nature here on Earth is very similar in terms of chemicals and proteins and, little locking key mechanisms in terms of enzymes and what DNA is. Almost every living thing on this planet has some code, this genetic code, and it is shared by all of us. So I get very spiritually lit up by that notion and kind of apply that this understanding of, wow, what is it to be healthy and what is it to have this body? And it really transcends all of our Western culture in terms of counting calories and exercising to the nth degree, because that's the only way for us to stay healthy, and all the stress that we kind of put on our bodies. So when we talk about the microbiome, I also come at it from the perspective of how well is your body digesting your food, because your food feeds them. And this is why eating healthy food is really important, and eating more plants is really important. So I'll get redundant when I start talking about dietary recommendations, but it's the basics and it's true. The more plants you eat, the more you're feeding a diverse number of different organisms in the body. But we also have to take into consideration our nervous system. And when I talk about the nervous system, I talk about our autonomic nervous system. And this is the part of our bodies that tells us when we are safe or when we're under threat, when we need to run from a predator, or when we can sit down, relax, go to sleep, and eat a meal. And when we have a capacity to dial in our nervous system to be able to be relaxed and to feel safe and receive food, that actually communicates in a reverse direction to not only all the organs of our body, our heart, our voice box, our stomach. Again, every organ in the body is connected based on this nervous system, but also it sends hormonal and chemical messages to the bacteria themselves. And so when we talk about the gut microbiome, we talk about the microbiome in general because it really is systemic. And in medicine, systemic means it's not localized to one specific site. And when I teach this concept of, inflammation and gut inflammation and leaky gut and all these different concepts, because they're absolutely related to menopause and absolutely related to hormonal changes, but it's different than like the inflammation that happens when you cut your finger. That's localized to the tip of your finger. You see it swell, see it get red. It bleeds, and then that bleeding stops. That's called coagulation. What happens in the gut is really more of a systemic process, and again, it communicates via these chemical messengers, if you will. And the nervous system is like the Ethernet cord. It's like the cable, the hard phone line you have to pick up, right? So it's like analog. And so this analog system is what's first developed in our bodies as we're growing and maturing. We're like developing this hardwiring analog system. So in order to really understand the microbiome, I talk a lot about birth and what it means to be a mother and that whole process, because really the microbiome and the nervous system development start way back then. And it can actually be transferred to you as an infant. And then depending on your environment, both from a dietary perspective, but also from a nurturing perspective, your nervous system and the bacteria kind of co-evolve, and that shapes who you are today. And the gut microbiome is as unique to us as individuals as our fingerprint. And that is not just true of the gut, that's also true of the vagina. Your vagina, you as an individual out there listening, is different than your mom, different than your girlfriend, different than any woman on this webinar. So we are all so uniquely different in the types of organisms that we have, and the diversity of the population, and also largely kind of our reactions to stress, our reactions to dietary changes, our reactions to hormonal changes. So it is a very individual response in terms of how you're kind of trying to be your best healthy self.
Yes. Well, no, and I like how you brought up the connection between the vagina and the gut. There is this there, and both parts are very prominent, I think, to women going through menopause. A lot of women I talk with are feeling like their digestion is changing, things in how their gut function changes during menopause. And then obviously during menopause, a lot is happening to the vagina, and a lot of changes happening there as well in that environment. Can you talk a little bit more about the connection? I think maybe for some people they're thinking, my gut is completely separate from my vagina. Please tell me how these two environments are connected.
Yeah. So again, from that hardwiring perspective, yeah, they're different. They're anatomically different locations. But from the systemic perspective of, something to kind of wrap your brain around is, how does cancer metastasize? Different cancers get to different parts of the body in different ways. Sometimes it goes through your lymphatics, sometimes it goes through your bloodstream. And largely lymphatics and bloodstream is how all these chemicals released by the bacteria also communicate. But remember, it's not one-sided. There's two parties in this conversation. Actually, there's multiple parties, but if you just say, okay, bacteria, gut microbiome, or microbiome critters, and then our body, it's a two-sided thing. So just like there are, hormones in the body. In fact, when we talk about menopause, we largely talk about estrogen and progesterone. And there are estrogen receptors, not just in the vagina, not just in the ovary, not just in the brain, but they're actually in our mouth and line our entire gastrointestinal tract. And something else equally profound is stress hormone receptors are also throughout the entire gastrointestinal tract. And this research has been available since the late 90s, and largely has been conducted in rats because rats are very easy to control. But this test to what happens when a rat is stressed, what happens when a rat is given an oophorectomy, what happens when its ovaries are removed, and then what are the systemic effects? And then science is now able to actually see these different estrogen receptors expressed in all these different tissue sites across the body. So in a nutshell, everything we do impacts our gut health. Menopause is such a kind of a shock to our system hormonally. Women are really gifted. I'll say gifted because I want to change the narrative to be more pleasantly sounding. But you know, we go through transitions when we're born. As women, we get a lot of female hormones from our mom. Some infants are born menstruating and with little breasts because of the hormonal effect given passed down from mom. And as we go through puberty, that's another influx and change in hormones. As we go through pregnancy, another dramatic change in hormones. And then as we go through menopause, another dramatic change. And in each of those situations, it's either there's an expression of more estrogen or less estrogen. And so what happens in the vagina largely kind of stays in the vagina, although in pregnancy studies, we've identified that gut bacteria, vaginal bacteria, mouth bacteria, all of that can be found in a placenta. So how it's getting there is probably through blood or lymphatic route, but what's causing it to leak out of the site, that is still kind of being teased out. We don't really know. We do know that when the body is under profound amounts of stress, and I'll keep emphasizing stress because our reactions and our fear around the unknown of what's happening to my body, it's too soon, and you know, not sleeping, that can be very stressful. Gaining a little bit of weight for an unexplained reason can be a little bit stressful. And then also just being mindful that maybe we aren't always taking perfect care of ourselves, right? Maybe I had an extra glass of wine last night. Maybe I stayed up too late and, you know, didn't get enough sleep. Maybe I ate fast food on a road trip. You know, these things also happen and they do have effects on the microbiome. And by no means are we trying to go for perfection. We're just trying to understand our body so that we know how to respond appropriately. I might be getting off on a little bit of a tangent here, but I just want people to understand that when the body gets really stressed, our stress hormone physiology does trigger a response in the gut, creating open leaky tight junctions. And I remember, if you can go back to the webinar I did with you guys in, was that March or April?
It's March or April. Yeah.
I talked a lot about the anatomical layers that are involved in gut health. So you can either track that as a precursor to this, but leaky gut is where the gut cells themselves are no longer fitting together like a puzzle piece. So stress can cause that. And there has been a direct association, not that necessarily low estrogen causes leaky gut, but that low estrogen in those menopausal states are associated with leaky gut. So is there a similar mechanism like the stress hormone mechanism? When we have stress hormone activation, which is fight or flight, we do have an enzyme that directly breaks down the protein holding the gut lining together. And so I postulate that that could equally be true with estrogen getting low, with the different microbial environment maybe triggering other chemicals that could also do that. Just knowing that maybe we don't have that resiliency there as we used to, if that kind of makes sense, just because of the hormonal changes. Because there's a lot of emotional experiences that go on too, right? Irritability, sometimes acne, and then definitely vaginal dryness, which we can discuss as well.
Yeah, and I like that you're also highlighting, like I mentioned in the beginning, this is complex.
Very complex.
If you came here for, tell me what to do for my microbiome so that I can solve every menopause symptom, probably not going to find that. And don't listen to the person that tells you that they're going to provide that for you, because it doesn't exist yet.
No.
Maybe as we continue to learn more, but right now, these complexities, and I appreciate, Erika, that you are also talking about this idea of stress. We live in a stressful environment. We are we're confounded with stress all the time. We're now in a pandemic. We are also looking at racism and protests and riots. A lot of things are compounding right now. Can you talk more on the stress piece? I know that that's an area of interest for you, but then also the connection with women's health specifically, and then bringing it back to the microbiome. How are these things all connected?
Yeah, I'm going to do a little bit of a plug here. I just launched a 4-hour webinar series that talks to this in exquisite detail. And if you go to my website, lavellayourguts.com, you will find all of them there. You can just watch them again and again. Because the stress connection piece is so absolutely critical. And what I've been reflecting a lot on is just that the narrative, the storytelling around menopause has largely been a negative one. And if we tell ourselves that what we're going through is bad, then it's gonna, and we also don't understand it very well. Not that I understand it perfectly, I'm just adding a different perspective here. But that when we can, I mean, and I, from my own personal experience, the more informed I have, the less anxiety I have because I can kind of anticipate it and I can trust it and I know that it's okay. So I think part of leaning into some of this menopausal discussion in these transitions is kind of honoring that part of you. I mentioned grandma theory earlier because I have a curiosity for anthropology. And I was really curious what menopause, how that shows up in other cultures, other traditions, but also other mammals, because this nervous system piece and how our body reacts to our environment is shared by almost every animal on the planet with a vertebra. And so part of our nervous system, if you believe in evolution, science believes in evolution, that there is a trajectory in which mammals diverge from reptiles. And so reptiles are really good at having a slow metabolism. They don't need to eat for days. It can be freezing cold. They just slow down, they stay there. And then if it's warm, maybe they can scurry really fast. But they really have a freeze state or they have kind of an activation state. They don't really have much of this parasympathetic kind of rest and digest. But mammals do. And when mammals get to exercise their capacity for smiling, singing, hugging, embracing, all sorts of magical things happen to us. Oxytocin goes through the roof. As a woman, our estrogen actually naturally increases when we have female bonding. So all of these things kind of come together. The grandma theory, which again, I'm brand new to, so I'm not an expert in, but I will mention it, is a PhD's perspective on the fact that humans, and like I see Gretchen mentioned, whales. So killer whales, they say just teethed whales, the ones that actually, I don't know, I think teeth being maybe they eat other animals or maybe they just don't eat the plankton, but killer whales specifically and humans are very unique in the whole animal kingdom in that we live for almost a third of our life beyond our reproductive capacity. And so then these PhDs also started reflecting on, okay, well, what do modern hunter-gatherer cultures, what is the role here? And what they noticed is without this Western world stimulation and without seeing these advertisements telling us that we can be forever youthful and we can, et cetera, right? I don't need to go into exaggeration. We all know, we all grocery shop, we all see the tabloids. We know what we're being sold. But there is, it's kind of this opportunity and it's like this cultural wisdom that when you come into the mode of no longer needing energy to reproduce, you can shift your energy and your focus to be more of an educator and a wise sage within your community. So they see a lot of grandmothers leaning in, helping teach youngsters skill-based things like with food production and all sorts of kind of village type things that you would associate with a grandmother. So I try to just celebrate all of these things that women are capable of and also honor the fact that it is a natural transition. The stress piece is just that the gut reacts so poorly to stress. And if we believe that these feelings, this irritability, the vaginal dryness, the lack of libido, the headaches, the inability to sleep, if we believe that this is something that is wrong with my body and something to be feared, and we don't really fully understand what's coming on, then that's going to create more stress and more anxiety. And it's a bidirectional relationship. So when we have stress hormone in the brain alerted to fight or flight, that irritability, I mean, honestly, conversations, driving in traffic, so many things can trigger us. So when we get triggered to that way, again, the tight junctions break, and then you get this leaky gut cycle. Again, my webinar series will explain leaky gut into a lot more detail. But it can be challenging because even eating healthy food can feel inflammatory when you have a leaky gut. And then what happens when you have more inflammation, or if you're stressing about the 10 pounds that you gained in the last 3 months, maybe you try to work out extra hard, but you're doing it on little sleep. So then you get an injury. And then what do you do to take care of that injury? You take ibuprofen. What does ibuprofen do? It actually further causes leaky gut. And so then you have a cycle kind of repeating itself there. So there's a lot of ways to think about the body and consider what's going on. And I encourage people to approach it not only from a mindfulness and kind of like, where am I feeling, what's going on in my nervous system, and create more space and more time for you to kind of relax. In the neuroscience world, we call it regulation. And so your ability to identify when you're in fight or flight or survival mode unnecessarily is your ability to develop regulation. Oh, Gretchen, you're gonna make me cry. Oh, yeah, okay, good. I'm glad because, yeah, you're gonna make me cry. We have a lot of bad medicine to undo. And my personal struggle and attention to my gut while I was in medical school really was compounded by stress. And we all are exposed to stress in different ways. And it's really sent me on another journey to study the vagus nerve and kind of, really get a good foundation for how it affects everything.
Yeah, lots of connections there, and certainly what you brought up too, the stress that compounds a lot of women and how that might be impacting their microbiome. And from the research that you have done, Erika, and I know you did an extensive deep dive on this before this topic, so thank you so much for spending the time. It sounds like what you really found is that perhaps it's more the stress response that women may have due to compounding factors during this life transition that may actually be changing the gut and the vaginal microbiome more than the transition itself or the hormones. Am I understanding that correctly? Or
Well,
go ahead and...
I would give it all equal weight.
Okay.
So, and that's just kind of like, again, not to get all yin yang on you, but that's how nature works. Everything is in opposition, but it's in opposition and balance. And even like this role of the vagus nerve, right? It's to help control. The brain is telling the body what it should be doing automatically without you thinking about it, but the body's also sensing it and communicating back to the brain what's going on. Mm-hmm. So everything is bidirectional. Nothing is just all or nothing. And again, that all or nothing thinking, that all or nothing medicine is what I'm like so kindly trying to bring to light. Mm-hmm. So having low estrogen, and this is the microbiome, the bacteria, they are so adaptable. In fact, every 20 minutes, it has been mapped out that there's new genetic changes in subsequent generations of bacteria. Mm. So they adapt very quickly, and they will respond to, again, what is going on in you. And I think about it kind of as like a soup, kind of like an ecosystem, right? So what's going on with climate change? We have rising CO2. That's creating changes in the atmosphere. So it's this whole like global effect. Some places are getting really cold, other places are getting warm, mm-hmm. But it's this whole earthly change. So when we go through menopause and we're no longer, and there's different stages too, right? So the first stage is like, okay, I'm just not ovulating. I still have estrogen, but I don't have that progesterone. And so you don't get that kind of like climatic release of like, to ovulate, which is very kind of, I don't know, it's exciting as a woman, I think, to ovulate. You feel very energetic. Everything kind of feels like it's falling into place. And that's just kind of like a high point in a menstrual cycle. So it's like you start losing that as your ovaries are just not releasing eggs as much. And it happens at different time points for different women. Mm-hmm. But then there's a part here where you can also get estrogen, too much estrogen. And so too much estrogen, which it just is appreciated by the unmatched progesterone, if the body is having gut changes, you're more prone to constipation, you aren't eliminating very well, then your body's not binding that extra estrogen and it's not excreting it. So too much estrogen can also be not good for us in terms of our total hormonal balance. That can contribute to weight gain, especially that middle weight gain. I remember one of your participants emailed about, being menopausal and then having just this belly fat that started accumulating. That is a sign of the stress effect, but that's also a sign of excess estrogen and not excreting it very well. So there's that point. And then when we get to the point of, ovarian, so many words are so negative, and I'm trying really hard to pick a good word, but when the ovary doesn't make estrogen anymore. So now you have low estrogen, and this is kind of like the final stages, like you're estrogen deficient. So when you get the vaginal dryness. And in that circumstance, the microbiome, your bacteria even have estrogen receptors. So the different populations of bacteria that normally thrive in an estrogenic environment, those ones start to kind of die off and different bacteria start to take over. And this has been associated with cardiovascular disease, heart attacks, being traced to changes in dental bacteria, the onset of getting gingivitis and dental caries post-menopausally in the setting of low estrogen is associated with osteoporosis. I mean, it's all interconnected and it's so wild. So at that point, that is where the research is starting to suggest that by eating phytoestrogens, so plant-based estrogenic kind of food. So there's a lot of plants in nature that naturally mimic estradiol. Flaxseed, lentils, beans, soy. Really, it's a big list of high fiber plant foods. They all have estrogenic type effects, soy being the most common, the highest level, but even flaxseed. So I think taking care of the body, taking care of the microbiome, which is to always feed them fiber, but to do that kind of throughout life with this understanding that there's broader implications is really helpful.
Absolutely. Yeah, again, really, there's a lot of things are connected, and one thing always has an impact on the other, and good to be aware of. And in some ways, our decisions, especially when it comes to what we eat, can have a great effect. So if you are choosing these fiber-rich foods, it's going to have benefits to a lot of systems in your body, not just the microbiome, but certainly the benefits through the bacteria and that communication that it provides.
Yes.
Awesome. Well, with some of those things, let's spend some time. You've talked about fiber, and you've talked about things that you touched on things that people can do to support their microbiome. I know our audience is probably like, okay, so what can I do? What can I do to help my vaginal microbiome? What can I do to help my gut microbiome? So what are some practical suggestions that you have based off of your experience and the research you've done?
Yeah, so there's one other scenario I want to bring up about how a dear friend of mine who practices gynecology, in reflecting on the microbiome, thought it was very important to mention. And this is that when the estrogen reaches its low point, post-menopausal period, there is actually a scenario where the vagina starts to kind of dry up. And this is where it's also associated with low libido. And something as simple as topical estrogen can increase the lubrication, the mucous membranes, et cetera. And in the microbiome literature, topical vaginal estrogen at this stage of menopause is associated with an increased abundance in lactobacillus bacteria. And lactobacillus bacteria being the ones that help regulate the pH, help mitigate vaginal yeast infections, help prevent bacterial vaginosis. And she actually brought this up to me, but that she's seen vaginal estrogen when applied to the urethral tissue. Can actually decrease and minimize symptoms of recurrent UTIs. And she thinks that recurrent UTIs are actually cystitis. So it's not actually an infection, but it's just irritation to the urethra from this dryness. Mm-hmm. And so if you can imagine people who have had vaginal, recurrent urinary tract infections or bacterial vaginosis repeatedly over time, their body is hyper alert to what those symptoms are. Mm-hmm. And so they might just simply pick up the phone and call their doctor, and their doctor goes, yep, sure, and just prescribes them antifungals or metronidazole, which is the antibiotic to treat the BV, without even really examining them or looking at them. Anyway, I just have to share that as a case study, because the more antibiotics, antifungals that you take, you're actually hurting your whole systemic ecosystem even more. And so I think it's important that we identify these patterns and learn about it from all these different perspectives so that we can learn to better support ourselves. So I am not a gynecologist. I don't prescribe estrogen. I don't do any of those things. But what I am is a nutritionist and a weight loss surgeon. And so I hang out with psychologists and dietitians and constantly reading this literature. So I do feel like I can help your participants in identifying some key behaviors that can help them during menopause. My number one recommendation is to try to relax. So many women get so hyper-focused on this kind of sympathetic drive, high intensity exercise, and just go, go, go. And so much so to the point of, I think, detriment, especially when we're going through these transitions. Sometimes our body just needs a little more rest. Okay, so I encourage you to find rest, and I encourage you to explore the parts of this nervous system work. That way you can explore what it means to have parasympathetic balance. On that same vein, if we're eating while we're standing up, if we're eating while we're running or on the go, if we aren't really, again, our brain has to be kind of attuned to what parasympathetic nervous system is, then that's going to help your gut so much better. In terms of specific foods, I haven't found anything super convincing telling me that phytoestrogens are bad or toxic or going to cause breast cancer. So I would eat tempeh. Tempeh is a fermented soybean product. It's a alternative to meat, but it is fermented, and it's fermented, and fermented foods traditionally are the probiotics that humans have been involved in eating for millennia. And so almost every culture around the world has some traditional fermented food. But tempeh is a good one. Miso, also being of soybean variety, miso is one of the most potent traditional probiotic foods out there. It has more living organisms in it than kefir or kombucha or sauerkraut, for that matter. So miso, and I think miso is delicious. I use miso as a vinaigrette. I use miso as a marinade, and it's quite delicious. You can also use it as a soup and like a bone broth. Sometimes when we are feeling stressed, feeling emotional lability, having these kind of gut symptoms come on, sometimes it's helpful to pursue protein supplementation in the form of amino acids. And I bring this up, and again, this is kind of a biochemistry lesson, but a lot of our microproteins, so big macroproteins being chicken or beef or tempeh, soy, whatever you're eating, the microproteins being what your body does to break it down into little usable bits. And there's certain amino acids that have names. And when the body is under stress and the body is not sleeping well, we want to support the pathways that build serotonin and build melatonin so that we have happiness, emotional regulation, and we can sleep better. So I would recommend tyrosine, tryptophan, and those, and 5-HTP, but those are specific supplements that can help regulate mood and get you to a point of sleeping. good sleep hygiene, which is turning off your TV, reading a book, baths, right? Epsom salt baths. I mean, think about your most favorite home self-care routines. And you want to do enough self-care that you feel really nourished in conjunction with exercise. But sometimes you have to redefine exercise. If you aren't feeling up to it, maybe a walk. Because if you're doing too much high intensity, that you actually might be raising your stress hormones too much for you on that given day at that given time. So just be really kind. And then flaxseed is great. Sesame seeds are great. Again, lentils, beans. And when I talk to people about gut health, if they're having a lot of GI symptoms, they're often very fearful to eat whole grains or eat legumes because it causes bloating and abdominal pain. But remember, your bacteria in your body are very adaptive. And so by feeding them these things in little amounts, working your way up, you're actually going to be, in as little as 20 minutes, promoting growth of beneficial bacteria. And by feeding them these phytoestrogens, you're actually bringing back into balance, and research has shown this, you're bringing back into balance the bacteria that thrive in estrogenic environments. And so you actually can do some hormone balancing. Doesn't mean you're gonna feel like you're 25. Doesn't mean you're gonna instantly have libido of a 25-year-old, but you're gonna be helping your body tip into that balance and just acknowledge that it's okay to go into grandma theory mode, right? So what nourishes you in that way? How can you give back? Maybe you're at your point where you want a career transition. I don't know. But I think having these conversations and supporting each other through these transitions is really, really helpful. And make sure you're pooping. Make sure you're pooping every day. And when you eat as many plants as I just described, you will be.
Excellent. Well, a lot there, Erica. I want to do just a little bit of a summary. And so jump in just to make sure I've captured these things. But first, going back to the UTIs and the estrogen, the vaginal estrogen. Certainly, if you are a woman who's experienced frequent UTIs and haven't had an exam for this, it sounds like you're recommending make sure you're meeting with a gynecologist or urologist or someone that specializes in that. And if you have questions, I will put in a plug for our telemedicine OBGYNs who specialize in menopause. They can prescribe the estrogen cream through our telemedicine if they feel it's best for you. And so if it's something you're interested in or have questions about, you can schedule an appointment to learn more. And our practitioners will make recommendations based off of your health history and your symptoms. So if it's something that they think is best for you in what you've described. And then I love how when you we're thinking about recommendations here, how it is about the whole person, the whole individual, and your recommendation to relax. I'm so glad that the women watching can hear this. I know with a lot of the clients I work with, that is the case. There is this for so long, women have just gone, go. And all of a sudden, menopause, perimenopause kind of throws a little wrench into things. And it's easier because they've been trained to go hard. It's easier to just push really hard forward. And these are super strong, intelligent women. So they're going to do what they know to do best. So taking a step back and resting and relaxing and giving yourself permission to do that is uncomfortable. It's a foreign concept. But I will say that's one of the things I work with a lot of women on is giving yourself permission to take a nap, giving yourself permission to take a step back. And it's not a moral judgment on yourself. You're not doing bad because you're not doing the same thing that you're used to. Listening to that, I think there's a lot of power in that. And a lot of women have felt better, but it's a matter of practicing and retraining that. So thank you for bringing that up. And then the other piece of just looking at those high quality plant foods and experimenting with what feels best for you, and knowing maybe not all of those things sit well for you, but can you try small amounts? And even small amounts can make a difference. So don't give up if one thing doesn't work or think that you have to do everything. Small amounts of incorporating those foods can make a difference.
And on that topic of diet, a lot of the literature is being studied on the premise of 4 to 6 weeks of dietary changes.
Mm-hmm.
And again, it's about diversity of plants. And I struggle with this personally too, because you have like the things that are your go-tos, the things that are easy, the things that you kind of commit to as part of your routine. So what I do as a personal practice is I try to venture out of my comfort zone and pick one new thing a week from the grocery store. And that might be a variety of bean, that might be something in the bulk bin where I actually have to go through the process of soaking it overnight and kind of slow preparing it versus just a quick grab out of the can, or, you know, a vegetable or an herb or something that I just haven't heard of before that's new at the market or something like that. So trying to kind of mix it up and add new diversity to your diet it's exciting, and your gut microbiome really likes it.
Excellent. Great tip there. Well, let's tackle some of these questions here. So we have several that have come in. So one is using boric acid suppositories for a recurring bacterial vaginosis. It is working with when my pH is off. So this person is doing this, says it's working when their pH is off. Is it healthy, or is it going to affect my good bacteria? Can you speak to this?
I actually don't know.
Okay.
So boric acid, I don't know what the pH is. I take more of I mean, that kind of seems like like, I don't know, you have a microbiome on your face too, right? And we do a lot of things to our face. And so we use like a toner, and the toner is supposed to regulate the pH after we cleanse, which can dry it out. And then we moisturize, you know, all those different things. I know that when it comes to the vagina, this was a quote from a man, gynecologist, by the way. He said, "Honey, it's a self-cleaning oven." And that's partly true. The lubrication, the secretions, right, the discharge, which again, I don't think that's like a pretty term, but the lubrication that our vaginas naturally make, the bacteria being present there do naturally help regulate the pH. So again, is this a low estrogen issue? I find that scenario to be so exquisitely true based on microbiome research. And then the fact that topical estrogen also is a lactobacillus promoting move. So that'd be something to look into. I don't know, boric acid is typically a disinfectant cleaner kind of thing. So it might not be helpful in terms of ecosystem balance, because that's how you have to think about these environments in our body. Is it's about the ecosystem. You know, while antibiotics can be life-saving, there's systemic effects in terms of the ecosystem. So you have to use probiotic foods in your diet, high fiber, again, so that the text messages and the Bluetooth communication throughout the body can really promote the survival of this entire global ecosystem.
That's a good reminder too, that there are some times where antibiotics are going to be needed, and in those situations, how can you promote some of that good bacteria with probiotics or the foods that you've been talking about? All right, next question here. I am now creating immunoglobulins to casein and gluten. My levels are through the roof, so I've changed my diet drastically in the last few weeks. How can I help downregulate what appears to be new allergies? Is this something you can speak to?
Gretchen, please go to my website and watch my webinars on gut microbiome. I think when I was last on Gennev, we did talk about the connection to the immune system. You have your largest immune system right underneath the gut lining and the gut wall. And it's there for a reason, because we're constantly putting the outside environment in through our body, and, you know, our body has to like process it. When we have leaky gut, which again, just going through menopause can cause it, taking ibuprofen can cause it, being stressed can cause it. So all of these scenarios, and remember, we can kind of go in and out of a stress response. And part of it is natural, but too much. So the stress that kind of lingers and creates dysregulation in the body, that's where the leaky gut kind of stuff comes from. So if your immune system's right here underneath the lining and it breaks open, then your body is going to start reacting to whatever you are eating. And this is what, again, this is my opinion. I'm not an allergist or an immunologist, but this is what the gut microbiome research is showing, is that when we have this chronic of a leaky gut, your body will react to whatever you're eating. And casein being a big protein molecule that is very hard to break down when we don't have enough acid secretion in the stomach. By the way, taking antacids is also associated with dysbiosis or a leaky gut. And gluten are also very big protein molecules. So if it's not being down appropriately and then it's leaking across the gut membrane, your immune system's naturally going to start reacting to it and giving you a systemic reaction to it. So my best, kindest advice is to consider this nervous system work. And sure, it makes perfect sense to avoid these foods while you're kind of in that space of, I'm going to rest, I'm going to relax, I'm going to do self-care, I'm going to learn how to meditate, I'm going to use heart rate variability training to identify how I'm breathing, right? Diaphragmatic breathing is the quickest way to turn on the parasympathetic nervous system. So, take a class on diaphragmatic breathing and then give it a few months or weeks and experiment again and have your allergy test repeated. And I have not been surprised to find out that people can be allergic to a whole new panel of things, and it's exactly what they're currently eating as part of their elimination diet. So it's a different perspective about the immune system, but basically we can develop allergies to anything we're eating when our gut is in that state.
Thanks for summarizing that. And another question, is miso gluten-free? To the best of my knowledge, it is. It just depends on how it's processed.
It should be. It absolutely
Yeah.
should be. If there's gluten in miso, then it's not the kind of miso you want to be buying.
Yeah. All right. So next question, I've been tested for hormone levels and my progesterone is low. No one has been clear when one's periods are irregular and months in between menstruation. How do I use the natural progesterone creams, evening or only after periods?
Honey, I don't know. I don't know.
I think that sounds like a question for one of our gynecologists or one of our telemedicine doctors.
Yes,
Yeah.
definitely.
Thank you for the questions. And again, we're being honest when we only want to give you the honest answer. So if we don't know, we're gonna let you know that as well. A comment here that this is a wonderful presentation and loved how you spoke about the grandma theory. She often calls this menopausal zest. Oh, that's another great term. Embrace it and give yourself some grace in the transition. Yeah, we should share that with more women. I think that's very much true. And one thing Erika and I have both talked about, and maybe we should have put this disclaimer at the beginning, full disclaimer, we are both premenopausal. So we are passionate about women thriving in all parts of their life. And in the work that we have done and learned about menopause, we honestly want to support all of you in menopause and creating this as a safe space to allow all women to transition healthfully and in a positive way. So trying to change that narrative and that conversation, but I do want to call that out to recognize that for all of you. Some of you may be wondering. The next question here is digesting Metamucil okay for your microbiome? What are your thoughts on those?
As far as I know, there's nothing wrong with Metamucil. It's a very specific type of fiber and it's an insoluble fiber. So I guess I encourage you to consider all these other plant foods as well. Because it's about diversity of the way that you're feeding it. In my awareness, the bacteria themselves don't necessarily eat Metamucil, but it is a type of insoluble fiber. It doesn't get absorbed. Bacteria don't really eat it. And it kind of helps your body form that gel that can help you have a easy to pass bowel movement. So it is very effective to promote regularity, but I do encourage you to add in additional types of fiber. I believe Metamucil is psyllium husk, a type of psyllium husk. So it's very bulky as well. So if you drink it or add water to it, it turns into a gel. And that's kind of how it stays in your body. But I think it's better than something like Miralax, which is polyethylene glycol, the same chemical that's found to make different household cleaners viscous. So I do promote psyllium husk as a good natural alternative that helps you form that gel, helps you have easy to pass bowel movements.
We are going to start finishing up here. We have a couple more questions that we'll answer, but thank you so much for your time, Erika, and anybody else that has questions. Like I said, if you have suggestions for our future webinars, we will have Erika back here on the second Wednesday of the month at 1 p.m. Pacific time. There was a question that came in on estrogen vaginal cream. Does it cause cancer? And what would we recommend for vaginal dryness? And I'm actually going to defer this question. We do have on our website in our learning library multiple articles on hormone replacement therapy and cancer, and our take on that from our Chief Medical Officer, Dr. Dunsmore Sue, and things to consider around that. So that will answer that. And really it comes down to the individual and what you as an individual need. And that same thing in terms of the vaginal dryness, you'd want to work with an OBGYN that can take your full health history into account and recommend something specific to you and your symptoms. One other question though on the microbiome, when experiencing a change in body odor during menopause, do you have any recommendations from a microbiome perspective?
The body odor. Well, I'll tell you from my personal experience, I stink the most when I'm really stressed out. So I think that there is in fact, me and my surgery partner, we both love Orange Theory, which is high intensity exercise. And, we sweat a lot during that whole experience. And that is very much a sympathetic thing. We're running, we're rowing, we're pushing, like it's a lot of high energy moving with your body. When we're in that sympathetic state, our whole blood flow shunts to the muscles. And, we're on alert. And it's good for stimulation. It's good to be focused, right? You exercise like that and you typically have this euphoric effect afterwards. I think it is nervous system training to some degree. But on the flip side, if we do something like hot yoga and we're breathing, using diaphragmatic breathing the whole time, and we're stretching and we're bending, that is also strenuous. I'm sweating a lot, but I smell different. I smell different in my high intensity class. My partner's a man, my surgery partner, and he's like, I stink after Orange Theory. And he's like, I don't stink after yoga. And I'm like, so I think that is part of it. But again, knowing that the whole entire ecosystem is changing, when we are low in estrogen hormonally as a system, there are certain species of bacteria that also just don't live in a low estrogen environment. And are those specifically the bacteria associated with odor? I don't know. The microbiome literature it's presented like this. This is a 1,000-piece jigsaw puzzle, and we have one piece.
Lots to learn.
So much to learn.
Yeah.
So much to learn. But yes.
Well, thank you for giving us a glimpse of that piece. And maybe we're just looking at one slice of the piece in this one webinar. But really appreciate your time, Erika. Do you have any closing thoughts, remarks? And you've mentioned your website and your resources available there. Anything else in terms of any of our listeners want to get in touch with you or learn more from you?
You can definitely find me at lavellayourguts.com, and you can follow me on Instagram with Lavella Your Guts. I do have a Facebook page. I try to entertain them both. But I also really try to stay grounded and stay focused and stay present. And my personal journey has been on one of mindfulness and this nervous system work. And while I've been studying nutrition since undergrad, 2004, really what's making the rubber meet the road for me is this nervous system and acknowledgement that everything we do affects our our microbiome. And I focus on the gut a lot, but the vagina is it's the same. It's the same microbiome. So yeah, come follow me, watch my webinars, email me, ask me questions. And thank you so much for having me today, Stacy.
Absolutely. And we did get one question about any books. So if you, Erika, if you have any, maybe send them to Shannon of books. This person mentioned that they've read The Second Brain, but we can send those out. Any reading resources we can link in our follow-up email.
I'll name two. Peter Levine wrote a book. So he's a trauma specialist.
And trauma specialists from the realm of psychology, they know nervous system work. I think it's called Crouching Tiger, Hidden Dragon. There's another book called Polyvagal Theory, and this kind of explains how we as organisms are alerted to stress. And again, I talk about all of this stuff in my webinars. And then the third one is a new book, and I have not read it to full detail, but I've tuned into his Instagram lives and watched him read it out loud. And he is a gastroenterologist, and he goes by Dr. B, the gut doctor, the gut health MD on Instagram. And he just released a book called Fiber Fueled. And I am really excited about him and his work because I felt like I was on an island telling people to chill out their nervous system and eat as many plants as they can and embrace that aspect of immunity. And he's read the research like me, and he's actually promoting the same thing. So really, microbiome doesn't want you to be on an elimination diet. It doesn't want you to necessarily have to give up gluten and casein. What it wants is it wants this balance in the body. It doesn't want to feel under threat. Mm-hmm. And if we can keep our gut microbes happy with our nervous system work and dietary wise, just by eating more plant foods in general, you're going to live a very healthy, long life, which is great.
A good note to end on. Well, thank you very much to all of our participants for your questions and your attention today. And also just a reminder, if you are interested in learning more about this for yourself, you can work with any of our coaches. We are registered dietitians and can help you explore this balance, adding more vegetables, or even with the stress management, the sleep, and helping to balance the changes that are happening during menopause and gain more understanding. And then if you do have more medical related questions or want to explore different options from a OBGYN or naturopathic doctor perspective, we do have both of those on our telemedicine team. So those are available to you to schedule per appointment through telemedicine, the comfort of your own home. So very common right now during these times, but definitely an option available to you, and all of that can be scheduled and arranged through our website. So thank you everyone for your time today. Thank you again, Erika, and we look forward to seeing you again. So next week we will have another webinar coming out, so look for that email. And then Erika will be back here in August, the second Wednesday of August at 1 p.m. Pacific time.
Great. Bye.